Yeah. And I think, people talk a lot about, nurse is the most trusted profession, but, we also need to take on the authority of what we know, right? That understanding of like, this is how science works and this is how medicine works. Given that the science appears to point us in the good direction, we should follow the science.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Oh, but first, a disclaimer. The views, thoughts, and opinions expressed in this podcast solely belong to Dr. Wolf and myself, and do not necessarily reflect our employers, our organizations, or anyone else for that matter. So there you go. Let's do this. Enjoy the episode. Okay. Hey, everybody. Thanks for joining us for the Art of Emergency Nursing. And I am with Lisa Wolf. And Lisa, I wanted to get you on the podcast to talk a little bit about the COVID-19 vaccine. So we are all hearing that there's a vaccine in the pipeline. There's vaccines, multiple vaccines coming. And I think a lot of nurses have a lot of questions and hesitations and fears and all those mixed emotions where they're just not really sure. And they maybe haven't taken the time to do the research. Note to the audience that looking at Facebook does not count as research. So I thought, well, who do I know that I could talk to about research that would have researched all this? And I thought, who would I know? What researcher could I possibly reach out to? And I first thought, of course, was you, my friend.
I'll always answer the phone when you call.
I know, and I appreciate that. That's the coolest thing ever. So Lisa, what do you know about the COVID-19 vaccines? What are your thoughts?
First of all, like deep and profound relief that we might have a chance of getting our lives back.
Like the idea of having a vaccine, it makes me so happy because I got to tell you, as cool as my masks are.
That is a very cool mask.
And this one's cool.
That is cool
as my masks are. I'm done with masks. I want to be done with masks. Now I know I won't be completely, but should I have hope? Should I be hopeful?
Yeah, absolutely. What's coming out thus far of the data in these phase 3 trials, and I'll talk a little bit about what trial phases are in a minute, but coming out of the phase 3 trials, which is an efficacy trial, like does it work? We're seeing really fantastic efficacy rates in the Moderna one and the Pfizer one. A little bit less with the AstraZeneca Oxford one. And that is a different type of delivery mechanism, right? But the two, the Pfizer and the Moderna one, are both mRNA, messenger RNA type vaccines. And this is a really interesting type of process where they code for the spike, right? The antigen on the protein, on the viral protein. And that's what your body makes antibodies against, right? That's what you're mounting an immune response against. So it's not actually the virus itself. It's the antigen on the spike.
Interesting.
So it recognizes it.
So it tags the antigen.
Right. Tags the antigen. And so that's what you're making. So like all the viruses that we've grown up with, right? The MMR, the flu, even if you're old like me, maybe I was one of the last people, I think, to get a smallpox vaccine in 72 or 73. And what those are what are called attenuated or denatured viruses. Sometimes it's a live virus. So it's a little more hit or miss, right? Like those vaccines are generally really safe, really effective. They can make you feel crappy, for a bunch of days because you're, mounting an immune response. And this is a slightly different way to stimulate the immune system, which doesn't mean that there aren't those sort of normal expected side effects, right? Like the whole thing about, oh, well, I got a little bit of a fever, my arm hurt, I felt kind of crappy, right? That's an immune response. Like that's exactly what you want to happen, right? That's not bad at all.
I mean, like that happens every time I get a flu shot, and it's just kind of like, well, you just expect that.
Yeah, you're like, oh, my immune system is working really well. That's great. Yeah. That's what you want, right? So, so these 2 vaccines are being submitted to, I think they're asking for emergency use authorization, or EUA, today, right? So what's coming out in the news is that this vaccine could be available as early as 2 weeks from now.
Holy cow.
2 to 3 weeks from now, right? And a lot of so this has been a really amazing process of vaccine development and logistics, distribution logistics, and it's been incredible to see what happens when there is a singular focus on solving a problem. And
because the whole world's working on this, right?
Exactly,
the whole world's working on this.
Yeah, and that's why it was developed so fast, right? So I could talk a little bit about
that. Yeah, we got to come back to that, because that's one of the things that has me a little worried.
Right. Don't be worried. I'll make you feel better. Don't worry.
Okay.
Yeah. So I am excited. There are a couple of logistical challenges, mostly in the transport, right? Because it has to be at -80, both of them. But and logistically, you need to have two shots 28 days apart. Okay. So that's kind of a logistical nightmare. But if we can imagine, right? You could get all the nurses vaccinated by the end of the year, or early January, and then we could go to work and not worry about bringing it home to our families, and not worry about, right? Like that's the thing we're all worried about, right?
Absolutely right.
Is we go to work and we're concerned. Nope. Yeah, but the thing is, like, I realized this the other day as I was out running. Emergency providers, right? Like all of us who work in ERs, we are so used to so much risk that we don't understand. Like we sometimes, I think, don't recognize real risk. Right.
But this has been different. This has been different than all of that. Because I think this is one of the things that I think every nurse has felt is we know there's risk. We know there's risk to blood, all the stuff. There's a million risks to working in an emergency department. It's probably one of the most dangerous jobs out there. But we know that, and we accept that, and we accept that for a lot of different reasons.
But we don't accept that risk for our families. We accept it for ourselves.
We accept it for ourselves. And the part that scares us is that, maybe I'll be fine. Like my immune system can probably go out and chase squirrels, but my wife, maybe not so much.
Right.
And this is the thing that scares us, I think, most about this virus is this virus. One, you don't know if you have it, and you can feel fine and be spreading the virus.
Right.
And we're going to be spreading this to our loved ones at home, grandma, grandpa, our immunocompromised wife. And that's unacceptable.
Right. And so that's why the idea that there's an effective, safe vaccine kind of right over there is so exciting, because it means a lot of the anxiety around going to work goes away, right? Like there's a lot of terrible things still going on at work, right? Like people are still going to die, and they're still going to die, but they don't have to die alone, because we can be with them, right? Or we can, if we get enough people vaccinated, if people are still getting sick, we get, people can come into the hospital, right? People can go into nursing homes and visit their elderly relatives who are just withering away from lack of contact, right? Like all the people who have been saying like these lockdowns are terrible for all these social reasons, like they're not wrong, right? They're not wrong. And the ability to vaccinate high risk people is going to mitigate a lot of that until everybody gets vaccinated, right? Because my understanding is that it's going to be, frontline healthcare workers, and then it's going to be nursing home residents and the people who work with them, and then other essential workers like grocery store workers and meatpacking people, like all the other people who've had these huge outbreaks because they're so vulnerable. right? It doesn't mean all of us can go out to the bars, right? Just yet. But mitigating some of the worst effects of that isolation, I think, is also going to be really important.
Yeah, I think that's the thing that I think will be the biggest relief to healthcare providers, is to be able to go to work and have some confidence that you're going to be safe.
Right. Right. I mean, there's all the other things to worry about, but like, that's one thing you don't have to worry about.
Yeah. Yeah, for sure.
Right. And so I think, that's like reason number one: get your life back.
Absolutely. Yeah.
Get your life back.
I think that'd be nice to be able to to be able to do.
Oh my God, I can't wait to go out to dinner again. I haven't been out to dinner since March.
Yep, exactly. So, all right. So let's talk a little bit about what has made this virus different. Because the thing that I think makes a lot of people nervous is this seems to have happened so fast.
Oh, the vaccine. Yeah.
The vaccine has happened so fast. And that, that makes me a little nervous. That makes me a little nervous. I'm like,
all right, well, let me see if I can allay your anxiety just a little bit. So I used to work in clinical research. Like, that was my very first job. And I can tell you that it takes forever to test anything, a new medication, a new vaccine, any of these things. And the reason it takes so long is not because it takes so long to develop it necessarily, but there is this huge process of grant writing and getting sponsorship and getting money and getting facilities and, doing all these things. And there are years between these steps, right? In the normal course of events, right? Like, so I am working in my lab at Dana-Farber and I come up with a vaccine. Now I'm like, holy cow, this is really awesome. But my grant funding is limited and I have to reapply for it. And I have to show why it's so important that this vaccine is there. And then I have to recruit people to come to my lab and help me work on it. And then I have to recruit volunteers for a phase 1 trial to make sure it doesn't kill somebody while I'm checking on what the appropriate dosage is. And then another couple of years go by while I try to get more money so that I can run my phase 2 trial, which is a couple thousand people, right? And now I want to make sure that in a larger group, there isn't any safety issues, right? Will this vaccine produce a robust immune response? And is it safe in a bigger group of people, right? Who are maybe a little more varied, right? Like, so they're different ages and maybe they have a little comorbidity issue and that kind of thing, right? Phase 1 is always super healthy people. We just want to make sure we've got the right dose to make an immune response and we don't kill anybody, right? But years can go by between those two phases. And then you have to recruit 5,000 people for your phase 2. Well, where are you going to find those people and what, right? So it's a big gamish. And then if you want to do a huge phase 3 where you're talking, you have to test this thing out on 30, 40,000 people and then send them off into the world and see if they get sick, right? So the process itself, administratively and logistically, is prolonged. And that's why it takes so long to bring a vaccine to the public. Not because it takes so long to make the vaccine, but because the administrative process can be extremely long. Now, what's different about this is that, one, a lot of the groundwork had been done prior to the emergence of the SARS-CoV vaccine, COVID-2 vaccine. Because there were researchers working on the MERS, the Middle Eastern Respiratory Syndrome, and the SARS.
And are they closely related?
They're very close. They're coronaviruses, right? Yeah. They're the same kind of respiratory illnesses, viruses, highly contagious, right? And so they were working on developing vaccines for those illnesses, but they kind of died out. And so the important part of the vaccine is, does it work like in situ, right? Like, does it work out there in the world? And if there isn't enough virus out there in the world to see if it works, then you can't really test it, right? So all of this front loading had been done. And so the virus emerged in China in early December, like about a year ago, right? Early December, November, December last year. By January, early January, the Chinese scientists had sequenced the virus and published it. Said, here it is, right?
Wow.
So everybody in the world now at this point in January, Europe is burning, right? China is burning.
Yeah.
We're starting to everybody's starting to get very nervous that this is going to be a pretty bad pandemic. And so everybody's like, okay, we got to jump on this. So what you had was, I think there are at one point 110 different candidates in various stages of development.
Wow.
So every big farm company or lab and anybody who does this kind of work, in the world, was working on this at the same time. Right. And so what they were finding, what they were also able to, and then you've got governments supporting this, right? So all that administrative crap is just gone. Right? It's a snowplow process.
They're certainly greasing the wheels because they know this is one of the few times where we're like, okay, everybody's at risk. We all are at risk for this.
Right. All hands on deck. Let's go.
Yeah.
Right. So there were a lot of those administrative and financial barriers that make this process so long. We're just gone. And so you have a lot of really smart people all working on the same problem simultaneously. They were able to do the phases kind of in parallel, right? Not necessarily as much sequentially. So you could kind of do phase 1, phase 2 at the same time, right? We're going to check for dosage. Once we establish a dose, we're going right into phase 2 and test this out on, 5,000 people. And then once we realize that that's safe, now we just go to the huge trial. And there's enough circulating virus so that you can actually say with some certainty, going about your business in the world, if we only get 5% of people contracting the virus and the vast majority of them are in the placebo group, not the vaccine group, we can say, and I have not seen the original data, right? I don't think anybody's really seen the original data, but what is coming out as a report of that data is that the Moderna vaccine just came out today with information that the vaccine was 100% effective in preventing severe disease.
And what do they define as severe disease? Do they
in the hospital requiring oxygen, ventilators? Yeah. Right. So 100% and then 94% effective in preventing contraction of infection entirely.
Those are pretty good numbers.
That's pretty good numbers. So it takes people with way more expertise than I to look at that raw data and say, but here's the thing with the FDA at this point. Now imagine you're the FDA and you've got these vaccines. Right. And that you have exactly one shot to get this right. If you approve a vaccine,
if this goes sideways,
nobody will ever take that vaccine and we're going to be doing this forever. Right. Yep. So it is in their best interest, even getting the money and the big pharma and all that stuff to keep it in the equation if you want, but they don't have any success if the vaccine doesn't work and if it's not safe. There is no point in putting that out. You will never sell another product again, right?
Never. Done.
Right. So I think the folks at the FDA who have been pushing back in some wise against the push to cut some corners safety-wise. I think they stood their ground pretty strongly, and so I am a lot more comfortable with the process at this point. There is no political reason to speed this up now, right? There's the election is over. There's absolutely no reason for anybody to rush this faster than it can be proven to be safe. So in that sense, I'm not really seeing a huge problem. Okay. Does that make you feel a little better?
It does. I mean, knowing that, and it makes sense that everybody's working on this all together. that everybody's all kind of focusing on the same thing, because we know that they are going to get buckets and buckets of money if they can actually solve this problem and provide a vaccine that's effective. Like they're all the pharmas are going to be rich. I mean, they're all
everybody's going to be happy. But you know what? Vaccines don't really make a lot of money.
But so. they don't make a lot of money. But they're, they're going to.
They're going to be it will add to their credibility. Let's put it that way.
100% add to their credibility.
And you know what? That's fine.
And that's fine. I'm okay with that. I'm okay with it. If it works and it's
I want to go out to a bar again. Sure. Right?
Yeah.
So.
Gotcha. And knowing that a lot of these things have been kind of happening simultaneously. And I think there's a big factor that the government has tried to eliminate some of the red tape and some of funding was not an option. Funding was not an issue. There was funding to be had.
Right. But here's the thing also, the Pfizer vaccine did not get government funding. It was not part of that.
Oh, really?
Right. And they're both coming up with a reasonably good vaccine with a similar efficacy and safety profile. So, I think that's just a result of everybody working on this, and there had been some good groundwork done up to this point. So this type of virus was better understood. It wasn't actually a totally unknown type of virus, right? What was unknown, I think, was how contagious it is, and this whole idea of the long hauler, right? So even if people are like, well, I'm not going to die, right? Well, probably not. But this is like Russian roulette, like honestly, this virus, because you can have no symptoms at all and you're fine.
Yep.
Or
100%.
You can die, or you can be debilitated for who knows how long, right? We don't know. And there's no way to predict who gets what.
Right.
So, it's not even like we can stratify ourselves into, high, moderate, low risk. You just can't.
And I think I think all those are the things that have made nurses feel particularly vulnerable to this disease.
Right.
I know it certainly has for me. Like, I'm like going, holy cow. Like, I don't know how many nurses I know that were working with COVID-19 patients all day long, doing the full N95, gowns, mask, gloves, whole 9 yards. And then they go home and get it from the neighbor.
Right.
Like they go home, they go to a picnic and they get it at the picnic. They're and I remember talking to one nurse particularly who was like, I've been gowning up every single day and being uber safe at work. And then I go home and I realize, who ends up getting me as my neighbor. You're like,
right.
Like, but.
Right. And that's the thing, because it's almost like the hospital feels like a hospital feels like a safer place. Like if I could walk around in full PPE, I would be, I think, feeling a whole lot better.
Yeah.
And I think it's been like, like you say, it's the neighbors, it's these small gatherings, it's, people are just exhausted with taking precautions. And you know what? Here's the thing, like, this is the answer. This is the thing that lets you do that.
Yeah.
And so to me, it seems kind of like a no-brainer. Like, why on earth would you not be interested in this?
But now, I got to tell you, so I did a little bit of kind of straw polling and said, okay, like, let's, what are your thoughts? And posted that in a couple of groups of nurses and said, hey, what are your thoughts? And I got to tell you, there was a lot of hesitation and a lot of distrust out there.
Right. So do you think it kind of comes from the same thing that we were kind of talking about earlier? They're like, oh, this was developed really fast.
I think that's a big part of it. I think a big part of it is, how fast it was developed and how quick this seemed to go to market.
Right.
When, for a while, that was like almost a campaign promise of,
right.
We're gonna get you this. And
right.
When reality is, like science is ready when it's ready. It's not.
Exactly. Well, here's the other thing. Here's the other thing that I think it has happened, right? So, the federal response and the state response, right? Like the people who are supposed to be in charge keeping us safe. Some of them did a really good job. and some of them did a really terrible job. And I don't think it's fair that whether you live or die depends on what state you live in. That should not be the case in a pandemic. So what we have is a real patchwork of response, and where you have in some states, right? Like, I don't know if you've seen that video of the nurse from South Dakota, who's talking about people who are like, why are you intubating me? This isn't real, right? Like, with their last words are basically, why are you doing this? This isn't real. And, compare that to Massachusetts, right? Where everybody's been, we're getting a little less good at it, but, after the spring, people like locked down quick. There's almost no cases where I live. And which doesn't mean we're not very, very aware that there could be at any moment, right? And I think, have you ever read the book of like, it's about the sort of the different countries of the United States? It divides the United States into like 11 different regions, and really correlates the pandemic response in each region all the way back to who settled this area, right?
Interesting.
So where I'm from in New England, New York, that kind of area where we had a big spike when it first came and then kind of got it under control, is settled by people who are very, very community oriented, right? Like, we live and die as a community, right? So there's a lot of sense of protecting your neighbors and working together, and government is good and government's there to take care of you, like that kind of thing, in a good way, not in a paternalistic way, but like the government provides security and safety and gives you information and does all those things, right? Other places in the country, which especially out in the West, tend to be far more focused on individuals, right? So government is bad. People telling you what to do is bad. And so those areas those responses kind of mirror those areas, right? And so the outcomes are commensurately different. It's kind of interesting, kind of whether your region, not just your state, but kind of your region views government as a positive force or an intrusive force is really going to dictate how your state responded to this.
Yeah, because there are states that lock down just immediately, and we're like, let's do this, let's lock down, let's close everything.
All right, we're going to take care of everything. We're going to make sure people don't get sick. We're going to make sure they don't die.
And there are other states that were like, yeah, we'll be all right.
Yeah, and you know what? They were for a while.
For a while they were.
And now they're not.
So not as much. So,
right. So there's a lot of distrust, like kind of depending on where you are. I think there's an inherent kind of a built-in hardwired distrust of institutions. And so if, the government's telling me I have to get this vaccine, I immediately am not going to do it because government is bad.
Yeah.
And so I don't think that should be like a death sentence, but it's certainly something to consider as you're considering like why you would or would not accept a vaccine. Like, am I like have a little epistemological moment, right? Why do I think this is bad?
Yeah, absolutely. And I think that's one of the questions you got to ask yourself is, and one of the questions I posed to, Facebook was, hey guys, like, Have you looked at this at all? And if you have, what do you think? Like, do you think this is, we're being told that as healthcare workers, we're going to be top of the list. Do we want to be top of the list?
Oh, yes. Pick me.
Okay.
Like, pick me. Absolutely.
No.
Yeah.
I mean, it certainly makes the most sense because we are the ones who are going to get it, to deliver it, and spread it like crazy.
Right.
So.
Yeah. So why not? And I think there's also kind of like the ethical argument here, right? Given that there is, there's a duty to treat, right? There's a duty to be available for your patients, and not get them sick, right? Which is sort of the argument for why people should, get flu shots every year, because everybody in the hospital is immunosuppressed.
Yeah.
Everybody. That's why you're sick. You're immunosuppressed, right?
That's true.
And so those folks are more vulnerable to flu, where, and that's why we strongly recommend, in some places they mandate it. And I think they're well within their rights to do that, because there's a duty to keep your patients safe. That's the whole point you go into healthcare. It's the whole reason.
True. I mean, I don't think there's many nurses that willfully say, you know what, we'll take our chances. They'll probably be okay. Like,
I think there kind of are. I mean, I think there's a lot of nurses. I've still run into nurses that are like, I'm not getting a flu shot. Yeah. Why should I have to do that? You can't make me. I'm like, well, no, but you also don't have to work here. Right?
I remember someone saying, well, they can't make me do that. I go, well, actually, yes, they can.
Right. Well, you can't work without an MMR. You can't work without Hep B. You can't work, you have to have all of those things at your employee physical.
Yep. Exactly.
Right. I can't even tell you how many times, because I wouldn't titer out that I got an MMR,
Oh, sure. So more times than I probably care to remember. So.
Right. I mean, I remember being on the admissions committee at the university where I used to teach, and we were going through applications, and there was one student who was like, well, looking forward to coming, but I will not, I am, I'm trying to think, how did she put it? I'm philosophically against vaccination. And we were like, well, you'll need to go to nursing school somewhere else.
Yeah.
Because you don't get to expose patients to all your germs.
Yeah.
You just don't. So, and I don't know, in hospitals where I have worked, if you refuse a flu vaccine for whatever reason, you have to wear a mask all winter. You cannot be in a patient care area without being masked.
And, a lot of hospitals done that. And then some of the hospitals have said, no, even that's not enough. Or like, if you say no, then we're just going to let you go.
Right.
Like it's just 100%. It's just that. It's just,
right.
We're going to let you go.
Yeah. Well, when you go to the hospital, you should be, you should feel confident that you are not going to get sick there because your nurse doesn't believe in science. Like, I don't know. Right. I mean, I think
it's like you just can't. I mean, I totally get it.
Yeah. I mean, talk to people if you can, right? Like my parents' age, they're like 75 now, and talk to them about the polio vaccine and talk about how that is the game changer, right? Like every summer, kids would get sick, kids would die. They couldn't go to the pool. They couldn't go hang out with each other. They were like in summer lockdown. But once the vaccine came, right, they're like, everybody got it. And,
Interesting.
Right. I think this is, the sort of the anti-vax position that our immune systems are perfectly functional. And if you just ate enough organic food, you could fight off anything and never get sick. I think we have an object lesson in how that is not true.
Yeah, I think we've debunked that theory.
Yeah, pretty decisively.
Yeah. So yet there will still be anti-vaxxers.
Yes, there will.
Including healthcare workers.
Yeah, I think those two things cannot have an overlap in the Venn diagram anymore.
Yeah, I mean, I certainly see where you would say they can't. I don't know if that means it won't.
Right. Absolutely. I get it.
Yeah.
But I think that, your ethical obligation is to do everything you can to protect your patients.
Yeah. And this is
and yourself. Right. So
I think that's my thing is I'm very interested in keeping myself safe and keeping my family safe.
Right.
I mean, God bless my patients. I want to keep them safe too.
Right. But the primary, circle is you and your family.
I want to be able to hug my friends and family and say, I'm so glad to see you.
Right. And I'm telling you, my kid has not seen his friends in almost a year.
That's
my 16-year-old kid has not been able to hang out with his friends since March.
And is he doing okay? Is he going crazy? Is he doing all right?
Nah, he's got a suite upstairs and a gaming room, so that child is okay. But I mean, it's hard.
Yeah.
I
No, it's
mean,
hard.
it's hard.
I mean,
And
you
I
think
would be
about,
like, first in line, kid.
you think,
He's
I
like,
mean,
sign me up.
and just, my wife is, I think a lot of people on the that listen to the podcast know, my wife is immunocompromised. She's a transplant patient. So of course she has lived the life of a hermit for almost a year now. Like she's been
Right.
like in lockdown and she doesn't go where she wants to go and doesn't do what she wants to do. And,
Right.
she says the great thing is now that when she wears a mask out, that nobody bats an eyelash. When this was first starting, when COVID-19 was just getting started in China, we were in the airport and she was wearing a mask. And someone asked her, they're like, what are you afraid of this virus already? And she goes, no, I'm just a transplant patient trying to stay safe. And he's like, okay, good point. Good point. He was like ready to shame her for wearing a mask. This is when, people were showing up to like the airport in like body suits and everything else. And everyone else was like, what are you doing? But she shows up with a mask and they're like, guys, like, it was ready to shame her. And then she's like, no, I'm a transplant patient. He's like, yeah, you wear that mask. And now wearing a mask is like second nature. Everyone's wearing a mask. So, and I'm ready for that to be over. Like, I mean, I've accepted it. I do it. I willingly do it. I'm happy to do it. And I wear my mask to protect you and you wear your mask to protect me. And that's, we're certainly, that's how we're trying to do this. But I'll be ready for when we don't have to wear a mask and we can maybe go to a conference again.
Oh my God, I can't wait to like go and see people in real life.
Absolutely. And that's the part I think I'm really excited about is like seeing people. So,
Right. I would like to have people over. I would like to have a party. I would like to,
right.
do all those things.
Right. I agree. So I posted on Facebook in a couple different groups and just posed the question about vaccines and what were your fears? What were you thinking? And I got lots of responses.
Oh, I bet you did.
Um,
Are they thematically grouped or?
I think I think you could probably pull out some themes here. I think that there's a lot of people, there are a lot of healthcare workers that are like, sign me up. I'm in.
Yeah, I see what this does.
I've seen what COVID does. Don't want any of that. Let's get this vaccine. Sign me up.
Yeah.
And then I got some that are like, well, I'm not taking a vaccine for one said, I'm not taking this vaccine for the next 3 years. And I'm like,
Yeah, I saw that one. I was like,
seems kind of okay. That
it was a little arbitrary.
maybe.
Why 3 years?
I don't know what the thought process was on 3 years then. But and I think she in this particular comment said, we don't know a whole lot about this disease. And I think we know more about the disease than we
know that we'd like to not get it.
Well, we know that. But I think that scientists know a lot more about this disease than maybe they had previously. And we're sharing a lot of information throughout the world. So yeah, certainly there seems to be some fear. There certainly seems to be some fear in getting vaccinated. A lot of comments about choice, about whether it would be a choice thing or not. And certainly every healthcare organization has the opportunity to if they're a private organization, they certainly have the choice to make it either a mandated vaccine or not.
Right. Well, we're seeing this even
with flu.
Airlines. Like Qantas is saying you cannot fly to Australia without documentation of vaccination once it's available. Which means that once like an entire country does that, then other countries will do that as well. And I think you'll start to see that a little more, given the devastation, right? It's not just like, we don't want you to get sick. It's like the economy has tanked. The global economy has tanked. There are people who are out of work. There are people who are, especially in the States where we have no social safety net, People are being evicted. People are, have lost their health insurance in the middle of a pandemic.
Absolutely. It's been devastating. It's been the virus has been devastating throughout the country. Like,
right.
In
a lot of ways.
In a lot of different ways. I mean, it's not just the people who are in the hospital beds.
Right.
So
Right. So
yes, I think some of the themes I was saying was fear. I think there's fear, distrust. There's a lot of but a lot of people who are working with patients have all said, I've seen what this does. I don't want any part of that.
Right.
Which I think is something that I'm not surprised by even a little. So I think that's the thing that I certainly probably expected more than anything.
Right.
So let's see, where are some of the other posts?
Yeah, I think there's going to be a lot less cushion, right? Sort of choice cushion than there's been with other types of vaccines. I really think that given the devastating effect of this, on people, on the economy, on education, on everything, right? I think that institutions will be more inclined to say you must have this unless there's a medical reason why you cannot.
Yeah. And I think, certainly that is going to be now, have we heard who medically shouldn't get the virus? Have we heard that?
You know what? I do not know. It's not grown in eggs. So like people with egg allergies can take it. It's, I'm not seeing any big flags.
And someone asked the question, I don't know if you've heard, someone asked the question about, has it been tested with pregnancy? And I think the answer I heard was no.
I think that you are correct there. Generally, pregnant people are excluded from a lot of clinical trials because
the obvious
you know what the effect is. Although with a vaccine, right? So here's my thought on this. Like, they need to do more testing with children and with pregnant people.
Of course.
Most other vaccines that are attenuated, like flu vaccine, should be given to, the recommendation is that pregnant women get that by by the beginning of their second trimester, because the severe illness and dehydration that can come with a case of flu can put people into premature labor.
That would be bad.
That would be bad, right? So the recommendation, I think, across the board is that pregnant people get vaccinated against flu every year. If you're pregnant during flu season, you should get vaccinated. So my guess is that eventually that will be the same recommendation here, because we know that pregnant people have worse outcomes than people who are not pregnant.
Yeah.
So it seems like a group. So what you have here is you have a group who right now we don't know what the efficacy is for that group. And that's a group that needs to be protected then, right? So in the same way, you want to get your kid vaccinated for chickenpox so they don't go to a birthday party and infect, Bobby's mom who's pregnant and, cause Bobby's mom to have a miscarriage, right?
Yeah.
So there's a discrete group of people that we definitely need to protect until the full effects of the vaccine are better known.
Yeah. Let's see. Now, one of the things that someone had asked and someone had kind of commented on that I don't know if we do know the answer, is how long once you get the vaccine,
right, do you need to get it every year, or is it
going to be a yearly thing, or how long are the antibodies going to last, or is that why they're doing 2 doses?
Yeah, you get 2 doses 28 days apart. And what I have been reading, and again, this is science playing out in real time, right? So the scientific process is playing out in real time. So things seem to change very quickly as more information becomes available. But at this moment, November 30th, 2020, my understanding is that there's new information coming out that suggests that most people who have had COVID actually have a better immune response than initially thought, and those antibodies may last for a substantially longer time than was at first imagined. And then you have this other group of people who get it again, right? So I'm not really sure what's going on there.
Yeah.
The idea behind this vaccine is that the reason you have to get a flu vaccine every year is because there are different strains of flu. And they are different enough.
Yeah. So the flu shot I got had 4 strains.
Right. But because it is developed, they start working on it
like
in this like months and months ahead of time. They have to, it's like a best guess. What's circulating in Asia? What's going to make its way around, right? This particular type of virus does not mutate in the same way. And so chances are good that if it confers a really robust immune response, you should have lifetime immunity. But we don't know that for sure. But that, based on what we know about the virus and based on what we know about the vaccine, it should confer a good long time of immunity. You may need a booster every 5 years. Like, we don't know.
Yeah.
But I guess we'll find out.
One of the folks that commented on my own Facebook said that her husband was part of the Pfizer trial.
Right. I read that, and she had a really robust immune response.
And had a great immune response, and his antibodies are through the
great.
roof. And
good for him.
Great. I'm like, that's amazing. How cool is that?
Right. We want that.
Yeah. I mean, it's exactly
we want that for everybody.
So,
right.
Interesting.
Yeah. I think it becomes not just an issue for us, right, as nurses, but also the recommendations that we make to our patients, because they will ask us.
One of the things that really you mentioned, and it really kind of made me think about it, because it's absolutely true, is the community is going to look to nurses to see what we do.
Right.
And when I seen, and I've even said this myself, where I'm like, hey, let's give this a little time. Let's let this kind of run a course. Let's get a few people, make sure nobody grows a tail, nobody has things happening. And then maybe I'll get a vaccine down the road. But I think the community is really going to be, and if healthcare workers are distrusting the process, boy, what would that do? Like, what's the effect of that?
Right.
Like,
why would patients take that?
If I said no, right. If I said no, everyone in my family would say no, because they'd be like, well, Kevin's smart. They don't know. They'd be like, Kevin's smart and he's saying no, so we're going to say no too.
Right.
Right. So I really think they're going to look at us as like a weather vane for this, just to see whether.
Absolutely. Yeah. And I think, people talk a lot about, nurse is the most trusted profession, but, we also need to take on the authority of what we know, right? That understanding of, like, this is how science works, and this is how medicine works, and this is why I tell you to take your insulin every day, even though you don't like it and you don't know how it works, right? You would never say to a patient, well, certainly it's your choice to, stop smoking or not, as you're here in the hospital for the 3rd time this month with your COPD exacerbation, right? You would say, you know what? I really recommend strongly that you quit smoking, or I really recommend strongly that you try this, medicine, whatever it is, Chantix, or whatever the drug du jour is. You would never say to a patient who had a substance use problem, like, hey, you know what, this medicine that we're giving people to help you, the Suboxone, I don't know, I wouldn't take it myself, right? You would not do that. You'd be like, here's what the science says. This will make you better. You should try it.
Yeah. I think they're going to be looking at us for this as well, for sure.
Absolutely. And I think that given that the science appears to point us in the good direction, we should follow the science. Right? There's a lot of emotion around this, and a lot of
emotion around it.
I don't know why. Like, this is the light. This is the exit door, but I get that people are feeling like very gaslighted all around, right? Why should I get a vaccine for a virus that isn't even real, right? I don't know who could possibly hold that opinion right now, looking around them, no matter where you are in the country. But okay, we'll go for that. And you know, once this becomes available, I think, you know, we're obliged as emergency nurses, frontline people, to protect ourselves, our families, our patients, and to recommend it really strongly for the community, because it's what's going to stop this.
Well, Lisa, this has been great information. This is hopefully will help people like me who are kind of on the fence and kind of going, I don't really know kind of where I want to go with this.
Off the fence you go.
So hopefully this will, you know, kind of lead people to one, start doing some research. And if someone wanted to do some research, where would you recommend they start? Well,
you know, where I did a huge amount of looking, there's a huge amount of literature right now. If you go to Google Scholar, if you go to your hospital database, right, your journals database. If you are a student, go to your university database. But I think everybody has access to Google Scholar, and you put in, you know, vaccine development or COVID-19. I mean, there is a huge amount of peer-reviewed scientific literature in there, right? So it's not like YouTube videos and stuff like that. You know, this definitely has a bit more rigor to it. So that's where I would start. And you know, certainly if you don't trust the New York Times or the Washington Post, you know, look at the BBC. They also have very good nonpartisan reporting, because they're not, you know, American. So they're, you know, to get it from the European perspective, I think is also really important.
Yeah. I'm curious to see, you know, one of the things that didn't happen on my Facebook is a lot of my international friends didn't comment. So I'm gonna ping a couple of them guys and say, hey, what are your thoughts? What do you think? What's going on over there?
Yeah.
So I think that'd be interesting to do. So, well, Lisa, this has been great. I really appreciate you.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.
It's going to be a decision that's coming.
Yeah, I'm glad it was helpful.
Okay. Well, until next time.
Have a great night.
Have a great night.
All right. I'll talk to you soon.
Talk to you soon.